Hello, I am Emily Edwards. I am a student in the LEAP Health class. I am a freshman at the University of Utah, and I am a nursing major. My symposium project is about bringing attention to the mental health of healthcare workers and their environment while giving quality care to patients. During my research, I interviewed my mom, Jennifer, who is a medical assistant at the University of Utah. She works for an infusion center through the Huntsman Clinic. They do infusions for autoimmune and cancer patients, and are currently doing infusions for COVID-19 positive patients. I gathered some data from research articles. It is enlightening to learn about how stressful working in healthcare can be. There are statistics of how mental health problems have heightened during the pandemic. I am excited to get into this. Let's get started. I have included a quote from the book The Plague by Albert Camus. This book has a lot of connections to the COVID-19 pandemic, and people can find deep connections with some of the quotes. The quote I chose says, "There's no question of heroism in all this. It is a matter of common decency. That's an idea which may make some people smile, but the only means of fighting a plague is common decency." This quote was on page 163 and was said by Dr. Rayu. This quote relates to healthcare workers during our current pandemic because of their heroism working with the COVID-19 patients. Healthcare workers treat COVID-19 patients because it is common decency and it is their job. They still show heroism even if they don't think they are a hero. I also included a picture of Albert Camus. My thesis is healthcare workers have selflessly put patient safety first during the pandemic. After my research and an interview with my mom, Jennifer, who is a medical assistant, I learned that these workers have to put their safety and the patient's safety first. But putting the patient's safety first, that also gives the ability to provide safety for themselves. Although there is a big risk even after following protocols, there is a chance of getting sick or injured, but these healthcare workers do it because they know that the patients need them. Healthcare workers are usually caring people, and many make sure to give the best quality of care they can. Healthcare workers like Jennifer have good traits that make them good healthcare workers, such as good communication, attention to detail, empathetic, and a team player. This is a picture of my mom, Jennifer, in her work gear. She is required to wear goggles and has to wear her reading glasses under them and a level 3 mask with usual scrubs. A new protocol that was for everyone was to wear masks to slow the spread of the virus. When patients come into the clinic, they're required to wear a mask and the staff is already wearing one. Jennifer said interactions are still the same with being kind and getting to the root of their problems. Just have to be masked while doing the visit. Leaving the house without a mask is like forgetting your wallet now. It wouldn't be normal in public without a mask again. One difficulty of patient interactions is with these masks. There's a learning of how to listen to patients more carefully and talking well for patients with hearing problems. At Jennifer's clinic, they see COVID positive patients, and when they are seen, they have to be isolated from the other cancer patients, and so they split the clinic into 2 departments. There are a lot of protocols taken to ensure the safety of all the patients and make sure that they still get a good experience at the clinic. Jennifer spoke about interactions she had with a patient. A patient came in depressed and crying because they were sick. As a matter of fact, they were very sick with COVID and said, "Please let me die." You have to take care of the patient's health physically and emotionally sometimes. This was a shocking and sad thing to hear. I pray for patients like this to get better. This is a picture of one infusion chair station at Jennifer's work. At the beginning of the pandemic, many clinics joined the choice to do all outpatient appointments virtually. This made it so healthcare workers could work from home and the patients can stay home but still be treated for their healthcare needs. Going virtually made it safer for patients and staff to reduce the chances of spreading COVID-19. Although there were setbacks to working at home, healthcare workers that have children staying home makes working become a chaotic mess. Another difficulty is the patients that do not understand virtual appointments and or don't know how to use the internet to get onto the video chat. It is a learning curve for everyone, but is a great time for people to learn these new skills. Jennifer said during the interview that you get to know your family a lot better in quarantine because you're working from home and get to learn new working computer skills. There's always constant change, and some people may still be working from home and others may be working in clinics now. Many clinics still give the option to do a virtual visit. It is nice to have these choices for patients that are scared of coronavirus. Even though there's a lot of negatives to the coronavirus, it is good to find positives that are occurring besides the negatives. After the pandemic started, the CDC and World Health Organization made new protocols for patients and healthcare workers, such as the mask mandates. Healthcare already has regular protocols when working with infectious diseases, and coronavirus is an airborne pathogen. Airborne pathogen protocols are to wear a mask, or they can go as far as to wear a hazmat suit, and to keep the patient isolated with a mask on. In my interview with Jennifer, she said, "It changes every day, from one day just wearing a mask, not seeing patients just virtually, to seeing them but gowned up. It is learning to go with the flow. You can still treat patients well, just have to wear more PPE than we used to. It is good to have an attitude that things change. There's nothing we can do about it. Take a positive outlook, accept the change, and roll with it." This was enlightening to me, and I will take it with me while I am working in healthcare. Trying to have a positive outlook and roll with the changes is great. Most clinics at some point during the pandemic went to virtual appointments. Some patients still choose to be seen virtually, and it makes the patients feel safer while being treated for what they need. It is nice to know that you can see the doctor at home and be in your pajamas. This picture is one of Jennifer's coworkers. After putting on a gown, she realized it had 4 arms. She had said it's funny because people want nurses to have 4 arms, but unfortunately, we do not. A lot of people have had increased stress levels due to the pandemic. Jennifer said, "I find stress protecting and helping my family from COVID-19. There is also work stress with constant change of tactics. Then you get used to that change, but then it changes again. It starts to drain on you. I agree that it's definitely stressful because the CDC is learning new things about the virus all the time. So new protocols are being put in place and modified all the time. It can cause frustration and confusion." Lee's article says, "Safety of family had the highest role in stress, along with corrective guidance, effective safeguards for prevention of disease, and positive attitude from their colleagues, more in female staff. It is stressful to worry about your family and making sure everyone is safe while worrying about your co-workers." Symposium's article says, "Exposure to severe and chronic stressors generates work-related stress symptoms, such as burnout and STS, that in turn may also predispose medical professionals to a variety of mental health problems. These stressors can cause mental health problems, and then buildup can cause burnouts. Some other stressors from working in healthcare are perfectionist attitude, negative coworkers or team, and stress of patient anger. It is difficult working in a high-stress job, but also has good rewards. It is good to have a good support system." This is a picture of a sign in Jennifer's clinic that shows their restricted access because of isolation. Healthcare workers have shown to have an increase in mental health problems. There are many increases of insomnia due to stress and long hours of exhaustion. There is an increase in depression and anxiety too. Symposium's article says the secondary traumatization is related to the professional's indirect exposure to trauma through the patient's narratives and accounts of the traumatic events. STS stands for secondary traumatic stress, which is when healthcare workers hear traumatic stories from their patients and trauma carries with them. Healthcare workers are experiencing PTSD and STS from working and are having prolonged mental health issues. Symposium said studies have demonstrated that 18 to 57% of medical staff experience emotional distress during and after the outbreak of the infection. That is a big percentage of staff. that is experiencing mental health problems. Some clinics or hospitals have hired and brought in volunteers to help with the coronavirus pandemic, so medical staff are not working as such long, exhausting hours. This is a picture of a HEPA filter in Jennifer's clinic. Most clinics have one in a room that sick patients go into or just a general area to clean the air. HEPA filters have been nice to have during the coronavirus. It makes it feel safer and like the air is cleaner. People are trying to find new ways to reduce their stress levels and boredom. Jennifer found that talking through her stress with her husband and family while following HIPAA made her stress reduce. She also enjoys relaxing after work and doing crafts. Healthcare staff are trying to figure out what works best for them. Some may go to therapy, others may have relaxing days off. There are also studies that show that getting a good night's sleep will reduce stress and doing breathing exercises when in a stressful situation. Common advice is to write down your stressors and relieve it, and make sure to have a good time management. A good way to reduce stress is to meditate or do yoga. Even a healthier diet can help reduce stress. Good advice for anyone is to try and avoid conflict. One healthy habit of any employee is to keep an organized workspace. A great stressor for me is to listen to music on the drive home. It is good to have a good support system when working in a stressful environment, such as family and good coworkers. This picture is really unrelated to the project, but I thought I would show Jennifer's family, which is also mine. After all of the research I have collected, the realization that a lot has changed since the pandemic started, and is not going away anytime soon. The pandemic has caused a rise in mental health issues such as insomnia, depression, and anxiety. Patient interactions are always changing because of clinic protocols changing constantly, like going to virtual visits. The new normal way of seeing people is with a mask. There are ways to try and manage work stress during the pandemic, such as meditating, writing, and having a good support system. Jennifer said that she hopes things will get better. We are all strong. We can do it, and we are doing it. Coronavirus has been a learning curve for everyone around the world. There are new rules almost every single day, and the newest change is there will not be a mask mandate in a few days. I would like to thank my interviewee, Jennifer, for taking the time to talk with me to get a better understanding of my research. Finally, this is my works cited. Thank you for listening.